Hello guys, welcome back to the next episode of Let's Play Project Hospital, where we are having some exciting day coming up. Let's load it first. The big news is that we've been doing this challenge where we are doctors mode, so in an expert or whatever the name it is level. And we bumped into somebody in neurology who actually needs a brain surgery. Now, we already, luckily, neurology was the place where we had hospitalization. So the only thing we needed to do was, well, borrowing some more money than we originally had. So it's a bit expensive, but if you take a look, where is it? Oh, stop. Sorry. What happening? Oh, we are in the wrong direction. Sorry. Okay, back one. There you go. Here you go. Here is our here is our neurology department, and look at that. We just put on a new surgery. So it looks like we have $31,000 left, which sounds really nice, doesn't it? Only problem is we owe them 240,000 already. So if I'm able to give back like, let's say 20,000 at the end of the day, I would be thrilled because I really don't want to spend that much money. But now we have a surgery department. Let me actually take a look at something. I want to take a look at my doctor here because I have one surgeon. Which one is the surgeon? No. Oh, no, these are the so stupid. Oh, this one is 21%. Well, we have an anesthesiologist. We do have that. We have a surgeon. And we even have another doctor who is 9%. Okay. That's not something really great, to be honest. The operating room needs basically 3 doctors. So all the 3 doctors are going to come over here. Luckily, we only have another patient, so they really have the time. But that's why we're going to need so many more. And actually, we have to probably fill up these later. You know, we can have I think 6 here and 6 here. So 6 here and then 6 in the other place. So yeah, it should be enough. All right. Well, not gonna. Well, let's see if it can work because this person is only 21%. But whatever. Let's actually check out first how we are standing. As long as anybody is waiting for us. Since I transported the room, John Scott is not. He is really in a trouble because look at that. He already did so much, and we still have no idea what's wrong with him. But he's safely in our hospital, so we should be all right. Anyway, going to treat it. Okay, at least we have a few people treated. Right now became the challenge. Obviously, is still important for me. But it's kind of like not that important. Look at that. There are people who are bored, let's say people in the, I can't blame them. They are bored in the intensive care unit because there is nobody there. Well, you know what? I like to keep it that way. Let them be bored. I'm just looking for, hold on. Did I miss anybody? Waiting for me? No. Anybody waiting for the player? No. Well, both of them are treated in there. That's good. Nobody. I think we finished it at the right time. Oh no. Sarah Harris is waiting for us. Sorry. Who else? That's it. Okay. There you go. Alright. And who is the one? Hold on. Actually, sorry, go back a little bit. Who is the one in the neurology that is going to Daniel Hernandez. Yeah, he's gonna have the eye surgery. So I definitely want to make sure that he is there. Let's get rid of everybody else for now. Sarah Harris is the one who is waiting for us. Okay. So what I'm gonna do is I'm actually going to go. Actually, let's do it like this. I'm gonna probably keep the picture here. Actually, let's take a look where Sarah Harris is. We're gonna follow her around. Let's see how it works. Okay, she's gonna go. Actually, she still has not Sarah Harris. Sorry, Daniel Hernandez. Sorry. He is still walking somewhere, so apparently he's still gonna have a tonometry, but then he's gonna go. It looks like he's first going to bed, so he's going to be hospitalized. Maybe they do a tonometry first and then they do the rest. So let's actually watch him where he goes. I'm gonna try to follow, which means that I'm gonna slow down the time a little bit. And hold on. Actually, hold on. Let's go to this one is waiting for the player. Let's actually finish that up first. So you have you're also the neurology department is kind of busy right now, so that's gonna be interesting. But we do have hospitalization, so we can put in 5 people if you not 5, 4 people altogether, 3 more people. Actually, he's gonna be in the HDU, so we have 4 more spaces there if you want. Let's see. You already have eye pain, red eye, photophobia, and watery eyes, and we still don't know what the heck is wrong with you. Now that's kind of weird, isn't it? Do we have some kind of like evaluation or shit like that normally can clean up a lot of things? Evaluation. Let's do an evaluation first. Rachel Harris. He has laryngitis. Let's put this away so it's not in the middle of that. Laryngitis. We have pretty much all the symptoms. He already gets NSAIDs. All right, let's just treat him. Treat her. Let me see if it's our doctor. Jessica Johnson. No. Since it's not our doctor, I don't know if it even makes a difference, to be honest. But since it's not our doctor and we already finished everything, so let's just treat him. But let's see if he needs anything. Like, for example, swallow pain. I do want to give him the NSAIDs. Nasal congestion, not a big problem. Diet modification, I'm gonna give him. Apparently, the only thing I don't need to give them is the nasal drops, but that's fine. Okay. Let's go back here. Kata Berkeley. Okay, so he already got full treatment. Everything is good. So he can actually go home. I think he's all fine, right? And it's our doctor, so look at that here. We're gonna go 6 out of 60. There you go. Let's make sure that we don't lose sight of our... Oh, I think he is already in the elevator. Anyway, Judy Brown. Again, we already know what your problem is. That's great. You have some pain and breathing problems and also swelling limbs. That's interesting. Well, we already know what your problem is, so all we have to do is basically make sure that everything else is treated that we need. A physical would give you nothing here. Ice wrap. A thorax percussion would give you analgesics, but you already have that. How many people are here? Can I waste a little time on that? I don't really want to waste too much time, but everybody else is kind of happy, apparently. You know what? Let's just treat her. I'm sorry. No time for all the, playing around. However, you need bronchodilators, and because it's medium. Anti-inflammatory, No, you're fine. Alright, let's go back to David Hernandez. Where are you? He is already walking into the HDU room. That's good. Then you're cold. Try insert enteritis. Okay. I don't think we can do anything else to you. Ophthalmoscopy we did, right? Oh no, we cannot do ophthalmoscopy here, I believe. And it would be a... Well, loss of vision is kind of important, but I cannot do anything about it. So forget about it. We're just gonna treat you. And let's keep watching our dear patient coming and probably laying down. Now, what do we need? Everything is low, I guess. Oh no, we have some fever that we have to take care of. Fatigue is low. All right. Frank Brown, athlete foot or nail fungus? Okay, so I'm gonna do a physical. And I'm gonna do, Dana Harris actually can do actually, you know what? Let's do a physical first because I never know that this one would need the differential diagnosis or not. I'm really not sure. So let's just do a physical first. And let's see. In the meantime, he is in the bed and sleeping already. That's quick. I mean, he said that they are treating, waiting for surgical team. So the next thing is probably gonna be they're gonna go all over. Oh, favorite patient is collapsing. Oh no, no, no. What the heck? Heart failure. That's not a good thing. And he's... Are you serious? Just laying down there like that? So what can you do? Just do a defibrillation. And what else can you do? Nothing really. And probably you have to go to a TC hospitalization. Okay, so now if we can save him, we're gonna actually have this save a patient after one collapse. And that's gonna give us the next one in turn is a great candidate. Great. I'm not sure I'm so excited about it. But don't forget, we also have, so Paul Harris is the one. Let's get rid of these people. Because now we have two places we have to, oh no, look at this, his eyes are all white. Sorry about that, sir. Let's go to there. And what else can we do? Defibrillation and... Should we put him into TC? Or should we put him into ICU? I think let's put him into ICU. Oh, we cannot put him into ICU because we don't have a... Okay, apparently we can only put him into TC. Let's put him into TC and let's see what happens to him. Okay, I know, you have some other issues. We have a ton of patients, unfortunately. Hey, Sergey, how are you doing? Thank you so much for subscribing me, my friend. I saw it, and welcome. We are having multiple troubles right now. We have a person collapsing. We are getting ready for a surgery right here. The patient is still in bed. I don't even know where I should look. Either I want to look at him or look at the collapsed patients, I'm not sure. And at the same time, we are treating 60 patients without knowing anything about them. So that's... We have a lot in our hands, so you came in the right time if you're obviously chaos and scrambling. Okay, so he has weakness. I think what we have to do is do a physical, a chest. Let's do a temperature test. Does it have anywhere a possibility of temperature? Yeah, I'm pretty sure it has. So let's do a temperature test and let's take it from there. We don't even need to see it. Let's go back to Paul Harris. Frank Young, okay, he just got... Oh, he's also having some big problems. He has hypertension. Okay. Well, that's very simple to deal with. Just take that one. And when you've done with that, thorax we did. That was the last thing we did. Physical we, of course, did a long time ago. We don't need this. So basically, I'm going to give him this and at the same time just simply treat him. Daniel Jones is not our selected doctor, I believe. Oh, it is. Okay, you have a handful of things on your hand again. So we're going to give you the anticoagulants. Okay, but make sure that you get the antihypertensive medication first. I mean, I don't know. I hope that they have that sense. We give him broncholitis. It's low. Anxiety is low. He is already getting the cough suppressants for this, and he is getting the beta blockers for this. So let's see. I think we got everything. Just go. I hope. Okay, Frank Young, we have to keep an eye on him as well. Where is he, by the way? Okay, at least he's in the office, so he should be in good hands, right? Nancy Martinez. Let's go back to Paul Harris, though. I want to see him. Nancy Martinez has abdominal pain and weight loss. He is actually in the bed. He's waiting for some tests. She just shat, okay? Which is congratulations to him. We still have to analyze that, so just keep on sleeping. Thank you so much. Somebody is running to our friend here. He's still collapsing. Actually, he's already collapsed pretty much. Frank Brown. Okay, so physical is not enough. And let's do a... I believe if we do a differential diagnosis, I think it should take care of it. Okay, let's see. Collapsing. You have to give him defibrillation. So how's your day so far, Sergey? If you are still there. Oh, let's see. You have ear exams. We already did that. Physical, we did. So Jennifer Harris is not our doctor, so all you do is just treat this patient and get away from me because I want to see what happens here. Although also I want to check our patient here. He's still waiting for the surgical team in the bed. Okay. Would be nice to have like, if this game could have like windows, you know, like there would be a sub window here looking at this guy, sub window here looking at that guy, you know, if they could, I think it could be like a nice extra feature if they could have like, you know, you can see here who are they, but it's not enough. I would like to have some windows like actually watching what's going on with them, you know, like a picture-in-picture kind of thing. Am I expecting too much? I think so. Okay, so let's keep watching Paul Harris being treated, but at the same time Frank Brown. Look at that. It's true. So when I have this kind of things, physical exam is not going to be enough. Differential, just like when you have contusion or fracture or something like that, possibilities, you do a physical and a differential and you settled. If, of course, you have at least like 10% or whatever differential, it seems to be working enough. It's 17%, she can figure it out. So that's fine. All right, then Dana Harris, it's actually our doctor. So make sure that she's properly treated. He is properly treated. We're gonna give him the nail fungus, needs the antifungal. And we're gonna also give you, you don't even need the foot cream, to be honest. I'm not gonna give you the foot cream, I'm sorry. We are very stingy. No, He's still collapsing. Somebody's giving him some quick urgency help. That's good. All right, now you are scheduled response microbial cultivation. Did anything come out of it? Nothing. Okay, you know what? You are tired, so just rest. We're gonna give you rest. Like what else? We don't need anything else. Let's wait for the urine analysis. It's kind of getting difficult. Look at that. You still have 5 pages possibilities. That's like 30. Okay, 27 different possibilities, and I think that was what she had before. So I think she's gonna stay for a while. But okay, just take a rest. Let me see in the meantime what's going on. Come on, no doctor. Hey, doctor, don't just walk around. Are you serious? Okay, let's take a quick look at this guy here. He's still in bed. Are they like preparing for surgery at least? I don't see any preparation going on, honestly. And we should have all the people here, so where are they? Maybe they have to wait because some of them went to take a crap or something. Let's take a look, actually. I want to see what's going on. What are the people doing? Michael Scott, okay, hold on. First of all, I want to get rid of all the things that I don't want to see. Frank Young, it's not the one. Okay, so these two are the ones that I really want to monitor, because once I click somebody, it's going to appear here and can delete somebody that is already there. So, going to workplace, how nice of you. Idle, yeah, he is waiting for the others, I guess. That makes sense. Going to workplace, filling needs. Where are you, Carol? You are the surgeon. You know that, right? You are filling your needs. What kind of needs are you filling? And apparently she just came out of the elevator, so she's just going to fill her needs somewhere. It's a problem that, of course, I don't even have a toilet in the surgery, in the hospitalization area. We probably have to do that. Otherwise, these people really have to go away, far away. So let's actually maybe I should actually deal with that. Wait, cannot go up? What happened? What is going on? Does it bug out? Hold on. Okay, now it's good. I don't know what happened. So, you know what? Let's actually do something which I wasn't planning to do, but I think we need to do that. Let's actually put up a toilet here. All we're gonna do is we're gonna copy one from here. Let's see, this toilet should be nice, right? So we're just gonna go and not move, copy. Oh, that's not a toilet. Wait a minute. We have to be careful what we're doing. Here is the toilet. There you go. Hold on. It should be 4 times. 1, 2, 3, 4 times. 6, right? Yeah. Okay. Let's go up and put that toilet right here. Okay. It's a little bit of it's spending a little bit money, but I think it's necessary. Otherwise, people are gonna take care of their needs all somewhere very far away. I'm thinking if I should also put this one here just to make sure that these people are not. How much does it cost? Let's see. Where is it? Come on. Okay. Wait. Where are the rooms? Prefab. There you go. Prefab rooms for not orthopedia. Oh, by the way, it's okay. It is neurology. So prefab roofs or neurology doesn't really matter. Common room is this one. It's only 3,800. You know what? Let's do that, because that's going to take care of a lot of problems for us. All right, you guys can use that, because if you already have to do surgery and you have people in the HDU and you have already 2 patients, whatever, I think you guys deserve that. Okay, so let's actually go back to here. Let's go back to... I think let's go back to our collapse patient here. And Carol Walker, we don't need these people. These are all the nurses and doctors. There you go. So Daniel is still waiting in the room because people are going to pee, I guess. And this is the guy who is collapsing. Now, before anything though, I have to make sure. I think I might have somebody. Let's see, anybody waiting for the player Mari Garcia? I'm gonna put you on hold for a second. Just to make sure that we don't have anybody waiting for us. Oh, here you go. Mark Martinez is also waiting for us. You see, we have to make sure that we are not leaving anybody behind, because I did a little test last time and it came out with a fascinating result. I had some people waiting for us and I just let them wait. And they waited literally until the next morning. They were in the hospital, and after like 9, 10 o'clock the next morning, they started to say like, I've been waiting for so long, I'm not sure, I might even leave. I mean, are these people crazy? Like, stand up for yourself. Okay, here is this is the exact same situation I was talking about when you have ankle contusion, sprain, dislocated ankle, whatever. What you have to do is basically, if you have one like this one has 37% of differential diagnosis abilities, you do a physical. Oh no, wait. Oh yeah, he's gonna do a physical and differential. So why are you telling me that you're waiting for me? I already did that. What is he waiting for? Okay, let's just do it again. Hold on. Why are you telling me you're waiting for it? You haven't done any of that. How long has he been like this? We didn't have this just now, and I haven't given it to her. I gave it to her probably a long time ago. That's weird. Anyway, sometimes there are some little bugs in this game, I guess. And the same thing here. Broken ribs, chest contusion. Does she have a... No, she's a surgeon. So let's send him over to Mark Johnson, who has some differential abilities. So we're just going to do a physical. We already did. And all we do is do a differential, and that should turn... That should tell us what's wrong with him. So don't worry about it. All right. I think we're good. Let's just go to normal speed and let's take a look. Mari Garcia. Where is she, by the way? Oh, she's still outside. That's why. So hopefully she is going to somewhere. Okay, she finished everything, I guess. I think we can send him home. Everything is nicely suppressed. Done. Just go home, and we're gonna have some more. I think it's gonna turn to 7 once we finish these people. Okay, I think you're done. Yep. We're just gonna treat you like that. Nancy Cole is not our doctor, I believe. No, he's not, so she's not, so you're just gonna be treated. Thank you, go away. We still don't know what you're gonna get. Sarah Harris. I just told you what to do. Did I miss something? Did I miss something? I don't think so. Just Sarah Harris, right? Okay. Okay, Paul Harris. Okay, so he was transferred to Jennifer Foster. Where are you? I mean, he hasn't been yet, but patient with control doctor collapsed and had to be transferred to emergency. Oh, okay, so he was actually our patient originally, and we kind of lost him from the game, like from this thing. That's fine, that's fine, okay. Just go. And already this is the doctor who is actually taking care of him. He needs the defibrillation, you understand that, right? But they are still just trying to save him, so he might die. Oh no, please don't. Okay, Frank Brown, yeah, he's been treated, everything is good. So just go home, please. Frank Young, same thing here. He got everything he wanted. So he can actually... I think I can go home. Or should we... Wait a minute. We don't need... For sweating and anxiety, we're not gonna give it to him. So just go. I'm still worried about this guy here. Let's see if we can save him. Please do your best. I don't want that person right now. Now, okay, that's interesting. You have copperhead snakebite, PAD, which is peripheral artery disease. That would be a whole different department. Migraine would be a whole different department as well, and rattlesnake bite. Okay, we already did physical chest and temperature. If you have the rattlesnake bite, that actually... We cannot do a basic visual test here. That's a problem. Shoot, we cannot... That's funny. So we are in traumatology, and that would need a basic visual test, and we cannot do basic visual test in traumatology. So how am I supposed to deal with that? Because we still don't know what his problem is. Barbara Williams, he has a differential, so would a differential actually tell you something? Can we try that? Okay, we're just gonna try that. It could be a complete failure. Alright, Hugh John Scott has an ECG and still didn't have any problem, and look at that. We've done everything and we still don't know what your problem is. He's eating. He's in the hospital, so he's safe, but what else can we do with you though? Thorax, we could do an MRI. Blood pressure, I'm pretty sure we checked it already. We already did, like, look at that, 4 pages of things. I'm literally, although it has everything that I cannot even do, it literally becomes easier to take a look at here than here, you know? Odometry, would that help? I mean, I don't know if he can have that. He can be a serologic testing, we have done it, right? We have done PCR, blood, serologic, microbial, urine. Did we do a crap test? I mean, let's just think about it. He has a fatigue. Skin allergy test would tell us anything? I really don't think so. An autopsy would help if he died already, but he's not. Okay, let's see what can we do. I'm not even sure some of it, if it in any way could help us, because I mean, I could go through one by one everything, but it's really, we have done an ECG, nothing wrong. We could do an angiography, obviously. ELISA sampling. Gosh, this guy is a real problem. He would need a CT for a couple of things. We haven't given him a CT, but I mean, we have all the long. Basically, we did. Okay, what is this? I don't think so. Would this be helpful? USG, does it have anything that has USG? I mean, it's just, look at that. So many different things that I think let's do an angiography, okay? Because angiography seems to be coming up in a couple of places. PCR we already did. Or how about an echo? Have we done an echo yet? Can we do an echo? I'm not even sure we can. We cannot do an echo, but I think we should be able to do an urgent echo. I remember there was one called urgent echo. Can we do that? Or we did it already. Maybe we did it already. If we did it already, look at that. So echo is not going to help us. It doesn't look like it. I mean, we could start X-ray and MRI. Let's do an MRI. I mean, I'm really just out of ideas. Let's do an MRI. Let's check his crap, honestly. I mean, we haven't done some of the simple stuff, okay? Let's do those. This one, this one, this one, and this one. Just simple stuff, okay? Just do everything you can. Thank you. I'm sorry you're not gonna have a fun time over there, I know. But it is what it is. How are you doing? Hospitalized, collapsing. Okay, at least he's supposedly hospitalized. Finally, somebody came with a stretcher. And he's like, he's happy. I don't know why he's happy, but why are you happy? Did you see that? He was like, hey, I'm good. What the hell? Wait, where are you? I want you to be on the list, so we don't need any of these people. Okay, I want you on it. There you go. And by the way, so he's still not happy. And I want, actually, let's take a look at our neurology, because he's still in bed. Yeah, but I'm gonna highlight him here. So he's just filling free time. He's waiting for the surgery, I believe. 1, 2, 3 doctors, right? No, these are nurses. What? How many doctors are here now? Where are my doctors? 1. I mean, it's just impossible to get these people together, right? That's kind of crazy. Okay, you cannot do patient care. You just do nurse, just surgery, okay, right now. How about the other people? Okay, you can do that. All right. All right. Or you know what? You shouldn't even do patient transfers. You just do surgery for now. Okay? What I don't see are doctors, so it's kind of weird. Anyway, Paul Harris is there. Let's see where he's going. And Brooke Rodriguez is Copperhead snake bite, PAD or rattlesnake bite. Okay, at least we made it less with a differential diagnosis, but not less enough. So what else can we do that actually gonna help us? A blood test. Let's do a blood pressure. And yeah, blood pressure could help. At least get rid of maybe this one. All right, let's do blood pressure first. Let's do it one by one because I'm not sure. Okay, in the meantime, where are you going? Mary Garcia. Ankle contusion, ankle fracture, physical differential, and it didn't give us an answer. Ah, dang. All right, you do, what is it, an X-ray, lower limb. That's all what you need. Please, thank you. And we're gonna continue monitoring this patient of ours. So look at that. I thought that this episode would be about our first surgery, and we haven't even got anywhere close. Okay, blood pressure didn't show anything. That's not good. A blood test would take a long time. Go do an ECG. You know what? Let's do a blood draw anyway. And then do an ECG. Or have you done an ECG yet? No, not yet. Where is the ECG? It's so far, so hard to find sometimes. ECG, there you go. Okay, and let's see, this guy is coming into the TC hospital. This doctor is already waiting for him. Okay, come on. There you go. So, save patients after one collapse, reverse next one intern available for hire will be great candidate. I'm so happy. So he is already kind of saved. That's great. Now, let's actually take a look at here. What is the next goal here, though? Reach 80% patches at the end of the day at emergency. Give you 50,000. Now, we are definitely doing that. We are literally 100% at emergency. So, unless the game intentionally screw us up, we're basically gonna do that. End of the day is far away though, so whatever. But that's great. So we're gonna have some funds, guys. We need the money. That's very good. Okay, so now you're already in this hospital. I think they are still working on it, right? So hopefully it's gonna come up like, okay, so what happened? I'm not sure. Let's go to this patient first. He's already stable, in good hands. We don't have to worry about him. So, Julie Robinson. Oh, he's still doing his urine analysis. You know what? Just do it. Jennifer Taylor. Poison ivy or sunburn? Okay, you are in internal medicine, so we are hoping this is the problem. Anyway, we're gonna do a physical and let's do a temperature. Okay? And then that should be enough for now. So he is hospitalized, still collapsing, it says. So they are still working on, technically speaking. Waiting for player. Okay, abdominal pain. Yeah, right. Okay, physical. Let's do an abdominal palpation. Just let's throw in a temperature test as well. And let's go. Okay. Let's take a look in the meantime to our friend Daniel Hernandez. He is already being transferred to his surgery, which is the main goal was today to actually see. So, yeah, kidney stones, urinary tract infection. Sorry, not this one. This one. We already did temperature, physical. We did abdomen. We already did a CT, and it didn't show up. That's kind of weird because that would mean that that's not his problem, right? Supposedly. He can do physical, abdominal. We did. Urine analysis could be done. We haven't done that, but okay, let's do, just to make sure that everything is for sure, let's make a microbiome. That's the urine and a microbiome. Let's just be totally on the safe side. In the meantime, we're gonna have this guy here actually taken to surgery. Our first surgery, guys, and time is running out, unfortunately. Food content, okay, let's do the same thing again. Sarah Martin, you only have 1% though. You know, go over to Dana Harris and do a physical and differential. Okay, let's go. Let's see if we can finish this one. I'm not sure. Time is running out very fast. Okay, the surgery team is already in there. Actually, only 2 doctors. The third doctor is slowly coming over. Okay, I don't care about it right now. Fever. Yeah, let's do physical. Let's see actually how much your fever is. Let's do chest auscultation just for wasting a bit more time on it. Jennifer Taylor, come on. Okay, temperature doesn't show anything. So what? Temperature didn't see, chest auscultation. Let's do that. And let's do a speech listening. All right. Okay, so look at that. He is being treated. They are actually starting the operation, guys. Come on, come on, come on. Really bad timing because I need to go. So I think let's do a cliffhanger here, which nobody likes, me neither. We're gonna have a cliffhanger here, guys. We are going to stop here. This guy is really on the surgery table, so we're gonna start with that right away next time. We're gonna save here. Because unfortunately, I gotta go to work, so no choice. Let the surgery begin. Okay. And we are going to continue this next time. I really hope you guys liked this episode. If you did, please don't forget to hit the like button. And if you haven't subscribed yet, please make sure that you are subscribing. And I'm gonna see you guys very soon. All right, see you next time. It's gonna be the surgery itself. Bye bye.